And the cats got whatever disease the patient had. If they had cancer, they got cancer and they died. If they had arthritis, they got arthritis and died. So he was the very first holistic dentist that linked all of the diseases that people have to their mouths. So if you look at these two girls, they look healthy, but we never know what's going on in their mouths. You can have a root canal on the tooth that's on the breastbone, and we just don't know. But that's what we all strive for, is to have a healthy mouth. But if your mouth is not healthy, you can never heal. So in today's talk, I want to talk about all of these different areas. And at the end, we can even go into some toothpaste questions, because I just read some really good articles about that. And there's new buzzes on toothpaste as well. So nutrition, like Heather said, you gotta eat good whole foods, fermented vegetables, healthy fats. It's the Western price diet. Pasteurized, raised, and finished meats, good organ meats. We need essential vitamins A, D, and K to prevent tooth decay. You know, they always say, oh, it's eating a lot of sugar or carbs and not brushing. Well, truly, it's vitamin deficiency. If we don't give the nutrition to the body, it can't be healthy. And also for the airway and the development of the jaws, the position of the jaws. And this is a great book that Weston Price had. I had that on my shelves. It's a beautiful book where they had showed that, I think it was the Eskimos, Alaskan up there, they had great nutrition and their mouths were gorgeous, straight teeth, big wide arches, until the Western civilization came and they started eating a really poor diet, and then their mouths shrunk, their teeth got decayed. So in his book, he talks a lot about the Western diet that I just said, that the mouths actually collapse, the teeth, the arches actually get very narrow, which is why a lot of people now need orthodontics and expanders, because we didn't give the children the right nutrition as they're growing. They become mouth breathers, their tonsils get really enlarged, so they have to posture their heads more forward. The tongues sometimes are sitting on the bottom, which is actually pushing the lower jaw out to grow. So the whole face isn't the way it should look. Now, when that does happen, we do orthodontics, we put in expanders, and we can create beautiful middle thirds of the face. But in our newborn, we want to encourage nasal respiration. So we want them breathing through their nose, breastfeeding. But when you're breastfeeding, you want to put them up. Right? You want them to create a good seal with their tongue, so the tongue is pushing against the nipple up on the palate, and that's your natural expander. If you have the baby lying flat and the milk is coming out, it's almost like a nipple that would be on a bottom. So it's narrow and they're breathing through their mouth. So that's one thing I always try to teach my young moms in the practice, is make sure when the baby you are breastfeeding that you're holding them up, and I know it's tough at night, you're really tired. But we don't want to see milk dripping out of their mouths, because then they are mouth breathing. They got to make a really tight seal on the breast. Sometimes they can't. They have what's called ties, which would be the frenum, they call it frenum in the lip, or a tongue tie, and they just cannot get that tongue up. And usually, when the baby is born, especially if you have a midwife, they will check for all of that, and it can be released by a dentist when they're that young, and it's not that traumatic for the baby at that point. And it's actually a lot nicer for the mom, because then she doesn't have pain while breastfeeding. In my office, we do what's called a holistic approach to braces. Sometimes I still need to put in expanders in the mouth because the mouths are so narrow, but we use the MyoBrace system. So it's basically an 18-month program that every month we're teaching the child proper breathing through their nose, getting strengthening the tongue, getting it up to the palate, swallowing without lip movement. If you think about that, if your lips are moving, you're going to crowd the front teeth. And then when the tongue is up on the top, that's the natural retainer. And you see a lot of beautiful results. These are what the MyoBrace looks like. The first one is to get them breathing through their nose. There's some big holes in there. They wear it 1 to 2 hours during the day. Does not have to be solid while you're in the car, while they're reading a book, while they're playing a game. The second one is the workhorse that does the development of the arch. You do get some expansion with it, but sometimes some of these children need good 10 millimeters, which is pretty large because their mouths are so narrow. And in there, that little cage you see is basically an orthodontic appliance that brings jaws forward and opens the bite. Sometimes we need to strengthen the teeth because they're not straightening up in the front, and we use a dental alignment. And then one that's called a retainer. It's not like orthodontics. We don't care about the teeth. We're retaining jaw position because once the tongue is up there and they're nasal breathing, the jaws come forward, the bite's open. So here's some examples of what MyoBrace can achieve without braces. Pretty impressive. And the crowding, now this had an expander as well. And then the MyoBrace system. This one, you can see the teeth on the bottom left. It's a deep bite, and this tooth is locked behind. And this is just straight MyoBrace, how it opened the bite. You see the difference in the height? Right there is deep. You only see a little bit of the bottom tooth. And here you see whole top. And these teeth just came into position. With MyoBrace, you will get the 6 front teeth. These 6 will straighten. The back teeth will not straighten because those are double and triple rooted teeth. And a silicone tray will not move those teeth. Then you would need orthodontics. Let's see what else there is. So what we can do also is mouth tape. And sometimes we have to do that with the children, but even in adults, it's really good to breathe through your nose. So first thing I always say is make sure you can breathe through your nose, close your lips and practice during the day breathing. Then practice with the tape on your mouth. And they make certain mouth tapes. You can buy a surgical paper tape that you can rip off easily. You just put it on your lip and make a little, kind of like something you can grab in case you have to take it off, in the middle of the night. Like I said, know how to remove. But always practice first during the day, and I say that from personal experience, because the first time I was so excited and taped my mouth at night, oh my goodness, it felt like someone was suffocating me. I had to rip it off after about 2 minutes. So definitely practice during the day, and then your brain says, oh, okay, no one's suffocating me. Another thing I wanted to talk about, which I don't think it was in one of my other tapes before I get to dental decay, was the black shiners that you sometimes see under children's eyes. It's called venous pooling. So when they are not keeping their tongue up on the top, because if you practice that right now, put your tongue up on the top, you can breathe better. So what happens is their tonsils get enlarged because their tongues aren't up there. And the jaw position is back. So at night, you start to grind. So some people grind, and they'll say, oh, you're grinding because we're stressed. The child is stressed, or the adult is stressed. You have so many issues in your life. You can't handle it, you're grinding at night. Absolutely false. The reason why people grind is because the airway. At night when we're sleeping, that is when the brain is starting to work and uses the most oxygen. All your hormones start to get made at midnight, then at 2, and then at 5, at 4, the kidneys kick on. All the different hormones are getting made, and the brain needs oxygen to work. So it starts to say, I need more oxygen, I need more oxygen, and it's pushing the jaws forward to open up the airway that's in the back of the neck. So the airway's in the back, the jaw is pushed back, and if you look at the profiles, you'll see that on a lot of people. Your airway is pinched, it's small. So these are things to look for, and these are the things that we can help with. Any questions on that before I get into dental decay? Okay, I can't see, but I don't hear.
I think we're good.
Okay, great. So dental decay. So basically, it's adopting the really good diet that we spoke about in the very beginning, having good, grass-fed beef, having raw dairy if you can, eating good vegetables, fermented vegetables, I'm trying to think of the word, good soil, where they're growing it, which is also very difficult, even though we think we're getting healthy vegetables. You need good magnesium, phosphorus. And then we can heal beginning cavities, not once they have broken through. Now, some people will come when they have big holes in the teeth and they'll say, can't you fix, reverse it? Truly not really. You can get the top part when people really try. The very top part of that big hole can get remineralized, but the underneath really can't. So really, we want to prevent it by eating a good diet. I always recommend oil pulling. I got coconut, sesame, and jojoba there, but actually I've learned now from my patients, but I learn every day from my patients, that they use castor oil. Some people use castor oil to oil pull too. They say 20 minutes, I say impossible, as long as you can do it. We used to say every day, and now we say maybe only twice a week, because we are killing some of the good bacteria as well that we don't want to kill. We want the good and the bad. And with the little children, I always say those floss holders, to dip it in coconut oil and then floss in between all their back teeth, because that's where the baby teeth get decayed. The enamel on the baby teeth is very thin compared to adult teeth. And get a little bit of decay there and poof, like within a few months, they're big. So definitely, if they children, I'm impressed when they say they do oil pull, but if they can't even take the toothbrush after they use some of their toothpaste and brush it on their teeth. And this may be a good point. I don't have a slide for it because it was just what I was learning with the different toothpaste that are out there. But you always want to, of course, avoid fluoride. And I don't know if I have a slide for this. Yeah. Avoid fluoride, avoid SLS, which is the foaming agents. Then there's the dyes in some of the toothpaste, especially in the children's toothpaste we want to avoid, which we all know. The triclosan, which is a non-degradable antibiotic, and it's an endocrine disruptor and a very harsh chemical. Tea tree oil. Don't do tea tree oil because that will definitely kill the good bacteria in the mouth. Artificial sweeteners, a lot of them have that in there because they're very sweet, those toothpaste, and we don't want that. Bentonite clay. Some people make their own and they use them, but yet sometimes the testing has shown that there's elevated levels of aluminum, lead, and arsenic in the bentonite clay. So we have to be careful and know our sources and if they've been tested. Emulsifiers are in there that kind of make it foamy, and that causes inflammation in the intestine. So those are we don't realize how toxic those things are. In our office, when we do fillings, we use ones that don't have any BPA's in them. A lot of the materials that we use in dentistry are so toxic. The sealants that they use on children are plastics, they release estrogen, and truly, if they don't really disinfect the surface of the tooth, they're sealing in the bacteria, and then all of a sudden the child has a really big cavity underneath the sealants that you can't see until you would get a dental x-ray. So we don't really use that anymore in our office. I haven't done sealants in years, and the kids have beautiful teeth. They really do. So to remineralize teeth, what we talked about a little bit before, it takes a good 3 to 6 months, if possible. And I say only on the small beginning cavities. And then of course your diet, adding more calcium and phosphorus, the vitamin D, K, and we know A, which is the good dairy, and then the meats and the fats, magnesium. And if you're into homeopathy, which we are, is cell salts, the number 1 and 2. Those are nice to reverse and help with the cavities. And of course, we want high acidic foods, and if you do eat that, drink something really acidic, just rinse your mouth afterwards. And there we go, avoiding mercury fillings. That's a big one. As long as there is metal in the mouth, there's still mercury coming out of those mercury fillings. They call them amalgams or silver fillings, but 50% of those fillings, let's see, I gotta go back. Sorry. Well, Heather, I gotta get someone to help me with that one. Let's do this. All right, you may have, you have a big screen, or you see the side?
I see all the slides.
Oh, all right. Well, you may have to deal with me on that one.
There's only a couple left. You're all right.
Yeah, all right. So, I forgot what I was talking about now.
I think you were talking about mercury, maybe?
Oh, yes, the mercury. So we do this SMART protocol system. And if you're looking for a dentist to take out your metal fillings, you definitely don't want them just drilling. If they drill it out, they're re-exposing you to it. And we know that it would take 30 years, once the mercury's out of your teeth, for your body to get rid of the mercury. If it's possible. Some bodies cannot even detox because the bodies are not capable. They can have different issues with the methylation. So they have to do it properly. What we do is we give them good oxygen to breathe. We cover their head, the hair with caps. We cover their bodies with surgical gown. We wear surgical gowns, cover our heads. I wear a hazmat. And then we also put what's called a rubber dam on the teeth. So it isolates it, so while you're drilling, they're not getting any particles, and we chunk the old mercury fillings out. That's what you want. You don't want someone just drilling like crazy. Let's see. This one doesn't have. All right, that's not the end though. So I think they pulled up my wrong presentation, but I'm going to keep talking. There is a chart, a dental meridian chart, and I don't see it here, and I don't want to waste your time for researching. But each tooth is on an acupuncture meridian. The wisdom teeth are on the heart meridian and partial kidneys. Then as we move forward, the next tooth, the molar tooth, is on the intestine. Then as we go forward, the next first molar is on the breast meridian and thyroid meridian. Each tooth is on there. So now if we have a tooth that had a root canal, and root canals we know are very toxic because that's what Weston Price did. He took the root canal teeth out and put them underneath the cat's skin or the rabbit skins, and they all died. So why don't we like root canals being holistic? The reason is there's 3 miles of nerve in a tooth. When they do a root canal, they only go down into the main canal, and they don't get the other 2.5 miles of little tubules that are there. And that would always be leaking fungus into the body. So root canal teeth are always leaking fungus. Now, if your immune system is healthy and it can fight the infection coming off, and it's a low rate infection, people do great. And a lot of people do have root canals, and they're healthy, and they have no health issues. But all of a sudden, it puts something into their system, and now their body can't fight it anymore. So the breast meridian teeth, the top teeth is the first molar. On the bottom, it's the second premolars in front of the big molars. And those teeth, if someone has breast cancer, or even if they have a little lesion in the breast, those teeth need to come out if they have a root canal on them. Not necessarily just come out. If they're healthy teeth, we leave them. And that's not related. But that's the reason we don't like root canals. But I always give people the information, because what is your alternative if you don't want to do a root canal? It's just to have the tooth removed. And that, some people, have a hard time doing that. You know, there's some homeopathic remedies that we can use to help them get over the loss of a tooth, but you have to be comfortable with it. So I always say, trust your gut. If you feel that a root canal is in your best interest and you don't want to lose a tooth, then do the root canal. And then we watch it. I will share a story with you that I had a gentleman in the office that was 68. When he was 8 years old, he had to get a root canal on his front tooth. He had some trauma to it. And now I have to clear him for a kidney transplant. Well, the kidney meridian is on the 4 front teeth. And I looked at that x-ray, and the body was trying to eat that tooth that had a root canal from when he was 8 years old. It didn't look good on the x-ray. And he had another bad tooth. So I said, you know, you need to get the bad tooth out and that root canal tooth. It looks terrible on the x-ray. It's not a good tooth. Just get it out now before you have your transplant. So that's, because I have to clear him, so I wrote that down. He had to get those teeth out. He gives me a call about a week later and he says, Doc, you're not going to believe what happened. And I said, what? And he said, once that tooth came out, my dialysis tubing inside my body kinked, and I could not get dialysis for 5 days. Oh my gosh, are you okay? What's going on? And he said, my kidney started to work, and that tooth is on the kidney meridian. And that was the most powerful, it verified what I always knew, that the root canals are toxic. So I share that with you because that's something you really want to avoid. And I don't know if you people have seen that or not. Well, let's see what I did. And that's the end, but this isn't the proper one, but I'm not going to be able to pull up my other one. So let's talk about questions. Anybody have questions for me?
You were going to talk about toothpaste, so
Okay, yeah, definitely, talk about that. So now, what's the new buzzword in the toothpaste is nanohydroxyapatite. So, from what I've been reading, it has to be a certain shape, and it was just really approved at 23 because they weren't sure if it was going into the cellular level in the body, or if you were breathing it in, what would be happening. And they found that if it's nanohydroxyapatite does not exceed 10% of the toothpaste, and at least 98.5% of the nanoparticles are rod-shaped, the rest of them are not too needle-shaped, it's not so toxic, and it will get into the dental tubules. How you know that? I don't know. I think you would have to look up the brands and call the scientists, and would they even know the question to it? You know, a lot of people are doing that now with the nanohydroxy. It's much better than fluoride, so I would say yes to do it, and there's some, brands that we know are nice. So I would say if you want to try the nanohydroxyapatite, it won't hurt. You're not swallowing it, spit it out, and I think that would be fine. And some of the ingredients that are safe in the toothpaste would be glycerin, which is a vegetable glycerin. Stevia, it would be the only sweetener that I would think is good. And essential oils, except the tea tree oil, which we know is a little harsh on the bacteria, killing the good and the bad. Questions for me?
Is a cap the same as a root canal or no?
No, a cap or a crown, they call it, is not. It covers the entire tooth, and it's to hold the tooth together if you need one. There's different materials, though, that they're made of. So our body's all electrons. We're all electric. So you have to you want the same materials in the mouth. So if you have a lot of different crowns with different materials, it is throwing the electric off in our bodies. And that's one thing we don't really think about, but we want to. So a cap, if your dentist recommends it and it's necessary, broken tooth, or you had a large filling before and now they need to put a cap or crown on there, that's fine. I always recommend water pick. So where the crowns end, a lot of bacteria, the plaque, will sit on there. So you want to flush out the bacteria around the crown and also under the gums. Always point the water pick under the gums because the bacteria that's under there gives off an enzyme that eats the bone. So floss will not get down under the gum and flush out bacteria. It will just go down, in there. The bacteria lives in a biofilm, it's like Jello. So if you take floss and go through Jello, the floss comes right back up. It didn't break the Jello up. So you need a water pick. If you put the high pressure water at the Jello, it'll break it up. And I do always recommend a sonic toothbrush, one that vibrates. When you get your teeth cleaned in the dental office, they probably use an ultrasonic scaler, and it vibrates, makes a loud pitch sound, everyone hates it, and it's worth water. But you're basically breaking up the Jello and really doing a nice service for the patient, because you're really cleaning them out. When you do use a sonic toothbrush though, you don't scrub like a regular toothbrush. You actually place it on the tooth, let it vibrate and kill the bacteria, and go to the next tooth. And you go all the way around, and then all the way around on the bottom. That's what you would need to do. Let's see. That's really how you keep your mouth clean and healthy. Healthy gums should never bleed. Now, sometimes when people just start to use a water pick, they'll say, my gums were bleeding, so I stopped. But that was a good thing, because you're getting them healthy. You're getting rid of the bacteria that causes the bleeding. Like I said, healthy gums don't bleed. Give me another question.
Wisdom teeth. Conventional dentistry always wants to remove your wisdom teeth. What do you do?
Wisdom teeth, I think, are important. So I do not recommend wisdom teeth coming out unless they are pushing in like in a funny angle at the tooth in front, and there's a possibility that it's going to bother the tooth in front and you're going to lose that tooth. So that I don't recommend having them out. Sometimes I need to recommend it. And it's really interesting. I was at the airport down in Cincinnati, and there's a billboard now from the American Oral Surgery group, and it says, if you have your wisdom teeth or they haven't come in yet, see your dentist, they need to come out. I mean, blatant, just saying that. And most dentists refer, I mean, if you have a wisdom tooth, take it out, but why? As our mouths got smaller, we don't have space. But if the mouths are wide, I see a lot of the kids that have, their parents have always followed the Western price, and their wisdom teeth are coming in beautifully. It's just you got to get the toothbrush back there and keep it clean, and that's a hard thing to do. But really, they should not have to come out if we do everything properly. The wisdom teeth, we need them. Like I said, it's on the heart meridian and partial kidney, even though that doesn't show it on the actual chart. We need our wisdom teeth. That was a great question. Ozonated. So oxygen that we breathe in the air is O2, 2 molecules of oxygen. Ozone is 3 molecules of oxygen, O3. It is a natural disinfectant. It kills bacteria, virus, fungus, parasites, whatever's in our mouth, and it's probably all of the above. So all the water that we use in the office, when we're cleaning your teeth with the ultrasonic instruments, while I am drilling, it's ozonated water. So it is killing all the bacteria, virus, fungus, parasite. Underneath all my dental work, we use ozone gas. So we are still cleaning the inside of the tooth and killing all of the bacteria. Then what we do with ozone, we can do what's called nasal insufflation. Through olive oil, we put a little cannula over the nose, and we're ozonating and killing all the bacteria in the nose, and then in the ears through some moisture air. We put little, like a stethoscope in the ears, and we clean the ears out as well. Ozone is a beautiful thing. Some of the holistic MDs do ozone IVs. They do ozone, taking your blood out, called EBU, which is really a nice thing to do. So they're taking your blood out of one arm, cleaning it, not like dialysis, but they're cleaning it and then ozonating it and putting it back into the other arm. And that's a really nice service. We don't do that in our office. I don't have enough time to do all of that, but I wish I did, I could do that. But ozone is is beautiful, and you can get your own ozone machine, and a lot of my patients have since we've been doing it, and they love it, and they do their own ozone at home. They drink ozone water, which helps you absorb your supplements better if you are doing that. Don't want to drink it only, but ozone, they do their own insufflation in their nose. They can do, you can do rectal insufflation with ozone, which cleans your liver in 3 minutes. Ozone is a beautiful thing. It really is a nice thing to do. Thanks for asking that question.
I have 2 questions.
Sure.
What age do you recommend children starting to see a dentist? And then on the toothpaste topic, did you have any brands that you recommend?
Okay, so I always, if you read any of these books, they say, oh, 1.5. I don't know how you get them to sit in the chair. No, we did have a little 2-year-old come for the first time the other day, and actually, he was great. But I would say around 3. I mean, you're going to be brushing the teeth, hopefully, on your own, and if you see something that is concerning, then of course bring them in sooner. But I say 3 years old. A toothpaste brand, I really don't know the brands that well anymore, so I don't know. You have to just look at the ingredients. As long as, there's no fluoride, there's none of those, SLS, the foaming agent. I would probably avoid the nanohydroxyapatite in a child, only because, I don't know, we just don't know yet, and if it's going to absorb in the cellular level through the gums, and if it's going to cause anything going on with the DNA, I don't know if I've heard do enough in children. Any other questions?
I have a question on root canals. So do you have a recommendation? If so, say when I was 15, I took a softball to the mouth, all 3 of my front teeth are already root canaled. So do you have recommendations to already have them before we have this information?
I know, that's a tough one, especially when it's on the front teeth. You don't want to lose your front teeth. So then you say, what meridian is it on? Well, it's on the bladder, urogenital, kidney meridians. So you have issues in those areas. And if you say no, then I always say, let's just watch it. We know it is leaking some fungus, but all of a sudden you start to get a lot of, urinary tract infections. Then maybe it's something to think about. And then you can also get what's called a cone beam x-ray. I personally don't have regular x-rays. Sometimes can show it, but sometimes they can't. And even cone beams sometimes cannot tell that. When they, take out teeth, and if they don't clean the site where the tooth came out of, you can get what's called a cavitation. What is a cavitation? It's dead bone, so it's not healthy. So there's different grades of cavitations. Grade 1, 2, and 3, 3 being the worst. And those definitely need to be cleaned out by a holistic oral surgeon. We're very fortunate now. We have a holistic oral surgeon in Wilmington, Ohio. And then he does everything really nice with red light therapy, with ozone, with essential oils. He's a good oral surgeon. So if anyone had any cavitations, and most of them are where the wisdom teeth have been removed. That's usually where you'll see a cavitation. So yes, you have to be careful about that. So in your case, I probably would say to have your dentist check it out. Are they hurting? Sometimes people say, I had a root canal, but it's still sensitive. Well, that's because it's not a good tooth, and your body's giving you a message and it's telling you that. Get the tooth out. In the front, though, what do you do if you haven't taken them out? You can do what's called an implant, and there's 2 different kinds of implants. There's titanium implants, which is a metal, titanium metal, that's put into the bone, and it has to bond, it kind of assimilates into the bone, and then you can put a crown in there. The good news is you won't get decay around there, but the bad news is you sometimes have quite a bit of bone loss if you don't do the proper care of the implant, because the same bacteria that's under the gum giving off the enzyme that eats the bone is actually under the gum and giving you the same enzyme, and the titanium is like, screw, so it has all those different areas that the bacteria can attach to. The other type of implant is called a zirconium implant. They call it a white ceramic. And this gets a little, back and forth. Zirconium is a metal, but they put an oxide on that metal, so they call it a zirconium oxide, which then lets them say it is a white ceramic. Not a metal, they just call it a white ceramic. But if it was a real ceramic, which is glass, it would break if you try to put it into the bone. But that one is more biocompatible to the body because it's a straight cylinder, it's smooth, so we're not getting that bacteria attaching to the metal, the titanium. And I've done some research on my own with that because we are electrons, right? And if we ended up having to get a knee or a hip replacement, which is titanium, do you want to have a titanium implant? Or do you want to have a white ceramic zirconium metal that's covered with oxide? Well, research I'm finding when I'm doing it myself is that they're saying that since the oxide is on that zirconium, that it won't interfere with the electrons in our body, with the electricity. So I leave that up to you, and do what your gut says. Does it say that if I have zirconium in my mouth, and a lot of the crowns that dentists are now putting in are zirconium, which is that white ceramic, they call it, the zirconium metal with oxides on it, and they say that's not giving off any toxicity. So would you want titanium in case you need a hip, and this way you have all the same metals in the body, so we're not throwing off the electricity? And then you just have to be diligent in your cleaning, and those have been around a lot longer than the zirconium. Zirconium implants have been around in Europe. My friend in Germany was doing them for quite a while, way before we had them here in the States. So it's been around, but not as long as the titanium implants. So that would be the first thing, and they are expensive. It's not a cheap choice. The other option would be to do a bridge on the forefront teeth, so they would probably put crowns on the eye teeth, and then fake teeth are all attached, that's why it's bridged, and it would look like 6 individual teeth, and that's an option too, if you did not want to put metal into the body. So those are some of the options. That was a great question. Any other questions for me?
What type of fillings did you say you use?
So we used it, so depending now, we use a brand that's from Germany that when I've spoken to the scientist, he says there's no BPA in there, and that's what they recommend is no BPA because it doesn't release any estrogen. And most of the holistic dentists and the biocompatible dentists that I have talked to use the same brand that we do. So you just want to make sure there's no BPA in there, and there's no metals in there. Sometimes they'll put some liners in teeth that are called glass ionomers, and those release fluoride. So it's just, dentistry is very toxic. You have to question, and then most of the dentists will think you're cuckoo, but that's okay. The more cuckoo they think we are, the better, because we have to take care of ourselves, and we have to be our best advocates for our health. And like I said, if your mouth's not healthy, you'll never get healthy because you don't realize it. I had a patient the other day, and we were taking out her metal fillings, but she said, I've been working for years trying to get rid of, I think the conversation started, and I'm going to backtrack, when she has a glass of wine. I don't know how we got into that, but when she has a glass of wine, her face gets flushed. Oh, I said, well, you're fungus. You're all fungus, that's why. Your gut is fungus. And she just looked at me and she said, how do you know that? I said, well, that's why you get the rosacea, it's all fungus. So she said, yeah, I've been working on that for years. And then I just looked at her and I said, well, you're never going to clean up the fungus in your gut, no matter what you do, until you get the mercury out of your body. So once you get the mercury attracts fungus, and it's in the gut, so you got to get it out. The mercury fillings also with the gas that comes off of it when you brush or drink something hot passes the blood-brain barrier and blows up the neurons. I'm not going to say it's the cause of a lot of our diseases, but we do have a lot of diseases, And as Parkinson's, dementia, all of that is bacteria and heavy metals. So you gotta get that out. And then once it's out of your teeth, the mercury fillings, it's still not out of your body, because like I told you before, it would take 30 years for the body to get it out. So you have to then detox it, and there's many different methods of detoxing. That's another big talk, but that's really what would need to be done. So you want to avoid the metal fillings, you want to have fillings that have no BPA's in them. And when we do our crowns, I do an old porcelain crown, which most dentists don't do, but I find that's probably the most biocompatible. I don't do any zirconium that a lot of dentists do, and they're pretty teeth, but I just don't do those. That's a good question. Thanks, Heather.
When you talk about mouth breathing, like
Yes,
besides,
ADD, it comes all these dentists talking about, for advertising for airway issues, because it's like if you're not oxygenating enough, you ADD. The daydreamers, the kids that just can't focus, that's all airway issues. I mean, it's interesting. I mean, we need oxygen, and we just don't get enough of it. So the jaws are far back, it's closing the airway. So ADD is definitely, and it'd be interesting to do a study, which I never even thought about. The kids that are really ADD, just look at their profiles. Is it, when you look at the side, is it straight down or is it jaw going back? If you see like a big indent under the lower lip, the jaw's back. And that's always the first thing I do when I go into the room and I look at, especially new patients, and look at under their eyes. I just look at their profiles before I even say anything. And I'll say, do you get headaches, because their jaw is way back. And that's definitely, with the TMJ is gonna cause all these muscles get pulled back, and then you get neck issues. You have headaches that wrap around and go behind your eyes. You have clicking and popping, because the lower jaw is too far back. And when it opens, it has to come down and forward. And then the joint that's there, so you have the temporal bone, which is the T, the lower jaw is the mandible, and the J is the joint, TMJ. So if the jaw is far back, you can't eat like that. So that you open your mouth and the jaw clicks because it has to come down and forward. A lot of these people that jaws are far back are pain patients because we call it TMJ or TMD now is the new word, temporal mandibular dysfunction, but it's because of the jaw position. It's all airway issues. Jaw position is airway issues. A lot of orthodontics, one thing you don't want them to do is extract teeth if they can help it. Some of the schools they still teach it. My son who was an orthodontist in North Carolina, he had to do it. 4 cases, extracting teeth, pushing the jaws back. They still do that. And then you make this person into a dental cripple for the rest of their lives. What you want them to do is expand the mouth, get it large enough, and I always say younger, better, 7, 8, 9 years of age is what I'm doing them in the practice. So when the big teeth come in, they have space, and you can avoid a lot of crowding and problems down the road. And once you get the top jaw large enough, the lower jaw has space now to come down and forward, and a lot of times it even comes down and forward on its own. So it's really interesting. Airway is a problem with everything. Sleep apnea, they say, is airway. Well, when you wear a snore guard, which is something that people wear at night to open the bite and bring the jaw down and forward, could be a myo brace as well, opening up the airway. It's all airway issues, which hopefully we start catching, and they do more of it in the dental offices where to help the children. And I'm even seeing now some offices that just do airway, which is pretty interesting because there's such a need for it, and they don't really learn that in the dental schools. So unless you're going into, I guess, orthodontic program, they're not really teaching that, which is a shame.
What do you do for your patients with TMD issues as far as pain management? Because you're not going to get growth as for an adult.
with that?
So you can expand someone up to age 65. That was my oldest patient that I expanded. She was retiring and she paid for her kids and her grandkids ortho, and she said, I want my teeth to look pretty before she retires and moves to Florida. Your sutures really don't close like they say they do until we're in the 60s, really, is when they start to close. But let me think about that for a second. You can, in our office with TMJ, when someone comes in and they're a real bad pain patient, we get the jaws in the right alignment. And how do we do that? We relax the muscles of the face. Muscles have memory. So even if you change the position of the jaw, it's gonna go back. So you have to make something to put on the bottom teeth that's gonna hold the jaw in a more forward position. So we relax the muscles with a tension unit. And then with my coaxing and telling patients what to do, opening, closing, protruding, all of a sudden the body goes to the right spot and the jaws kind of come up. And then we shoot that bite with some material. And then we have what's made is called an orthotic. So an orthotic are orthotics. It's not a mouth guard. Like most dentists will give you a mouth guard that's flat, usually on the top, and you don't want to ever cross the midlines on the top if you can help it, because it fixes the cranial bones, and our bones are breathing and moving. That's why you can do cranial sacral therapy, because bones are always moving. Our sutures really aren't that close. But if once you cross the middle on the top, people get headaches, you're fixing the bones. So I always, say, even in orthodontics, when they finish orthodontics, a lower fixed retainer is okay. It's difficult to clean the teeth afterwards, of course, but on the bottom, it's okay. I do not like it on the top, because you're crossing the midlines on these kids and you're fixing their cranial bones. They're not breathing, they're not moving. So just on the bottom. So we make what's called an orthotic that is hand carved, that you wear 24/7. And once you bite, it pushes the lower jaw to the correct position, the level and aligns, because if you're sitting there right now and you bite your teeth together and then slide your lower jaw forward, your back teeth don't hit. So you need to put a shim in there, kind of, to hold it. And that's what the orthotic does. And then we watch, usually in our office, we ask, what are the 4 worst pain problems you have? It could be migraines, it could be face pain, neck issues, tingling in the fingers, what people sometimes think they have, the tingling, and they have the, carpal tunnel, they think it is. It could be TMJ, because the muscles in the neck get really tight. It pinches the brachial plexus, and then you have the tingling in the fingers. Very sensitive teeth to hot and cold is TMJ sometimes, because you're clenching the body, especially at night, right? It's trying to get the jaw open for the airway, and the teeth are on fire. They're always banging. Teeth are not fixed in our bone. They are not solid. There's a ligament around them. Teeth are always moving. That's why sometimes people have recession of the gums, of the bone, I should say. And that the gums, the root is exposed, and they have very sensitive teeth. And then the dentist will tell them, you've been brushing too hard, get a soft toothbrush. That's not true at all. The reason why that moves up is because of the bite, the jaw position. It's off. You're banging the teeth wrong. I mean, the top teeth have a middle line, let's say, a central groove. The bottom teeth should hit that central groove. But if it hits this part, the front part of it, and because your jaws aren't aligned, the teeth move, they flex. What's gonna happen? The gum's gonna move up, or the teeth are gonna wear down, and you're gonna break your teeth. The body's amazing. I mean, there's a reason why these things are in our mouth, and it's not you're brushing too hard. Your headaches and migraines sometimes are not because, the foods you're eating. No, sometimes it is diet, related allergies. But most of the times, it's jaw position, and I can tell that when I walk into an office. I had a patient, it was about a few years back, and we always take photos of our patients. And before I even went in the room, I looked at her photo, and I went, oh my gosh, this poor thing is in pain. So the first thing I walk in the room, and hello, and the next thing I say to her is, how long have you been in pain? And she just looked at me. And she goes, how do you know? I said, well, I looked at your photos, but her lower jaw was way back. I mean, and we talked about it, and she's been to every doctor, spent hundreds of thousands of dollars trying to figure out her migraines and her pain that they couldn't get rid of, and then she just did the orthotic and was pain-free. I mean, in the photos you take of the people before, you could just see their faces that's drained and they're in pain, but they don't know what to do because no one's ever told them it's coming from the jaw. They went every other doctor there is. No one can help them. But that's what we do. And then that orthotic is holding them in that new position, right? But muscles have memory. You take out that orthotic, and if you've been wearing it for 2 or 3 years, your jaw usually will hang in that spot. But if you don't put it back in, the brain and the muscles will take it right back to your old position. So there's a phase 2. So the first phase is really, I would say, a diagnostic phase, and I would say wear that orthotic for at least a year, and you might need a little bit of adjustments because as the body is changing, you know, the shoulders, everything is coming into alignment. Second phase could be do nothing and wean off of it and wear it just at night. A lot of patients are fine that way, and they don't have the headaches afterwards. You can do orthodontics after that to bring those back teeth into the new position and hold the bite together, because like I said, the muscles will go back. So this orthodontics, or you can put little shims, little porcelain shims on top of the teeth, a full mouth rehabilitation it would be. Or just continue to wear that. I mean, some people can't afford those other phases, and they just continue to wear that orthotic, and I just had to remake one after 5 years. She couldn't, you know, not wear it, and then it will wear it down. It's an acrylic, a metal acrylic. That's a material that, you know, they don't have any better material to make those orthotics out of, and mouth guards. But when they make a flat mouth guard, you're just, especially when you're sleeping, you could be falling even further back and closing your airway even more, which is why some people say, oh, I had a mouth guard, but I couldn't wear it because it was so uncomfortable, I just had to take it out at night. Yeah, because it was closing your airway, and the body's smart. The brain said, get it out of my mouth, I need to breathe. So yeah, that's what we do in our office. There are other approaches possibly, I'm sure there are, but that's the approach that I do. Any more questions about that? A meridian chart, and each tooth is numbered. So on your top right is the first molar, and it goes all the way to the wisdom tooth on the other side. On your top left is number 17, 16, and then it goes down 17 and then all the way around. And it'll tell you each tooth has a number and what meridian they are on. And then you can look it up on your own if you know you have a root canal in a certain tooth, see what meridian it's on, and see if you have any health issues in that area.
Awesome. And I'll try to find that and email it to the group too.
Okay, yeah, I'll send you the presentation I have that had all my other slides on it.
Awesome.
So I don't know, this one got pulled up. And then you can send them my final one that has the meridian chart on there and more about root canals and ortho and all that good stuff.
That'd be great. Thank you.
Oh yeah, you're very welcome. Wish you all the best.
All right. Thank you, Dr. Mindy.
You're very welcome.
She's really awesome. We do go to Cincinnati to see her. She's working on retiring and finding a replacement, but if anybody has any suggestions around this area, then we can always send it out. But she's been really great for our family. I know our old dentists, they were awesome, but I asked them about removing mercury fillings, and they pretty much told me, oh yeah, we can do it, but you don't really need to. And I was targeting some issues that I thought maybe they were causing, and they just kind of made me feel really dumb. And when I said I wasn't using fluoride, they were like, oh, do you do your own research? And I was like, well, yeah. And they were just like, they made me feel really bad about myself, and they were like, well, your teeth look great though. And I was like, so I haven't used fluoride for like 5 years, so why is it an issue that I don't use it? Like it was a little bit brutal, and it was kind of disheartening, because I was like, and Mindy even told me that the American Dental Association now isn't recommending it. So if your dentist for some reason is saying use it, say, well, can you double check the standards? So, because it is like causing health delays and things like that, or mental delays, I think. Anyway, so she kind of touched on it, but she mentioned, this is sort of a good segue, the link between like our food and soil and nutrients and all that stuff. And so my husband is actually here today because I begged him to come talk about permaculture. We've kind of done a deep dive over the past few years trying to figure out the best way to grow food and develop our land. So he's going to talk about that, but it really is, your soil health does matter. And Weston A. Price also talks about the more local you can eat, the better. So basically what's more local than your backyard. So he's going to kind of talk about some of that. Or if you can't grow it in your backyard, you know, we have a whole resource list of local resources that have organic foods, meats and things like that. So if you need that link, we can send that out.
I'm Ross Clayman. My background is kind of mostly an engineer in the automotive industry, working on kind of little rubber car parts that you've probably never heard of. But part of my job there is also like integrating it into the full vehicle and kind of understanding the whole vehicle as a system. And like maybe it's possible beauty, you know, like natural lines, like that. So permaculture.
You like to click on there, I don't know. I just like using that.
So yeah. So basically, like Heather said, we were kind of looking at many years ago, we bought some property off of my grandma that we kind of have always wanted to build on, but we didn't know what to do with our lifestyle. So permaculture kind of has a lot of principles to help guide you through that, and kind of for your whole life too. It can kind of help, you know, guide you there as well. Yeah, so I'm just going to go over like very tip of the iceberg kind of stuff. It goes very deep. So permaculture starts from basically two words: perma as permanent, and culture for something that will help kind of guide humans throughout their life. So permaculture together is a human culture with permanence mindset. Permaculture can be a few of these things shown here, where zones are kind of to help you with your time management, basing your activity on how close or how frequent you use them, companion planting, as opposed to kind of a monocrop culture. The diversity of that system will help you increase its resilience to possible diseases or issues. And then kind of energy, harnessing that energy and using it as much as you can before it's gone. And kind of swales here, something I've been working on a lot lately, to help you kind of harness energy as well. And hold water. Obviously we're in a drought, so holding water would be great for growing things. So one particular thing they kind of mentioned in permaculture is try to make something, one feature should serve at least three purposes. So kind of like I mentioned, permaculture can kind of go throughout your life. So if I'm doing a morning stretch, I'm not just, you know, stretching my neck, but I'm also stretching at least three other things at the same time. So it's kind of using all that, combining all that energy into one useful thing. So this kind of shows, along with that, serving three purposes. This is just kind of our backyard garden. So we use like a cover crop of clover, which one purpose would be holding moisture, because it's a living mulch, holding moisture in the soil. Clover is a natural nitrogen fixer. So when something like a bunny would eat it, the roots would die back, release nitrogen in the soil. And then it's also feeding the rabbit, which can help prevent the rabbit from eating your food. And then the rabbit can leave a little fertilizer behind for you. So yeah, we ran into that this summer, and I thought that was pretty neat to see that actually in full swing. Permaculture comes from based on 3 ethics. So your primary one is earth care, people care, and then fair share. So care for the earth would be making sure you take care of your resources, your soil, forests, water. Care for people would be like a small community, like this Weston A. Price Foundation, for example, sharing good food. And then fair share would be considering not only for a human, but also for the other animals, plants, pollinators, considering all that entire group. They also have 12 design principles. I won't go over them all, but they're really good for helping you make decisions and kind of moving on from there. So I'm just going to go through a couple high-level topics that permaculture is kind of known for. So they talk about zones, and zones are basically, like I mentioned, considering your time, trying to make your time as efficient as possible. So it doesn't have to be only for gardening. It can be also for many other things, like this building, something you're using all the time. You want to design that so you're close to it. But permaculture mainly focuses on the homesteading, kind of gardening aspect. So that's what we kind of talk about here. So zone 1, and I like to think about it kind of by a time perspective. So by the minute you are in your home. So this is supposed to be your home, whatever, home area. So you're in there all the time, when you're not at work or wherever. But then zone 1 is something you might be checking a couple hours a day, like your garden, fragile fruits, that kind of thing. Zone 2 would be maybe once a day or twice a day. That could be a kitchen garden, like vegetables. Zone 3 would be a little bit further away of a distance. So that could be like an orchard or a pasture. Zone 4 is kind of like, something you rarely go in, maybe once a month, semi-managed kind of a perspective. And then Zone 5 is kind of something you would basically go in maybe once a year, hunt in there or something. But basically, just something to consider for many other reasons I'll get into. So zones, as I said, here's your home, and it kind of goes further out. In reality, they're not circles, but we show it as circles just for explanation purposes. And then sectors are external energy that would go into something such as your sun, rain, wind. You could also consider smells, road noise. What else did I say? Yeah, or if you want a good view of the sunset or whatever. So you kind of combine all those into one. Like a sun, for example, doesn't really, it changes every day, but it always follows a consistent pattern based on the time of the year. So in summer, it's always high. Winter, it goes down low. And then also fire as well. It's really dry, so if you're next to a cornfield, can you plant something as a barrier against that? Sectors. And then food forests. So that's something we've been working on a lot lately, is how does, in this area, how does a forest out in the middle of nowhere, how does it grow without human intervention? Kind of humans think we're so smart, I gotta put all this fertilizer on something, I gotta do all these things to make something grow, but right over here is a forest just doing it all by itself. So, permaculture tries to basically mimic that by growing a food forest. So a guild is one primary tree with supporting some species around it, more vertically integrated. So as you go, you have one tall tree, which could be like an apple tree. Then you go down to smaller layers, like shrubs and berries, you know, root vegetables, cover crops, you know, kind of integrating all that together. More of a polyculture approach rather than monoculture, where monoculture is, you know, can kind of get dangerous because where if one disease or pest or something happens, it's like a feeding frenzy where you can just, they can have at it, right? Where if you have a polyculture and it's diverse, it's hard, it's a lot of energy for something to come in, eat something, and then go, that they like, and go far away to the next spot where it is again. And that kind of builds that strength in the polyculture kind of food forest. So what we also do is, I mentioned growing vertically, which would be like, this is the top view of that. You know, plants are kind of going down. And then they also grow horizontally, where you're not only harvesting crops, you're, like I said, the fair share, where you're giving back to that ecology. So something we're doing now, I'll get to in a little minute. You grow horizontally, you put these guilds in each spot. So you have like, this is a nitrogen fixer, like a honey locust tree or black locust, which actually will exchange nitrogen for sugars in the soil. And then that nitrogen will feed this apple tree and all the plants below it, and this apple tree with all the plants below it, or plum, pear, peach, whatever kind you want to do. So it kind of goes nitrogen fixer, fruit, fruit, nitrogen fixer, fruit, fruit, and it kind of goes horizontally as well. Like I mentioned, the sun is something you can use as an energy input and harness that. So the sun in the summer solstice and the winter solstice is the highest and lowest points that the sun will be at in the kind of the skyline there. So that's a consistent pattern. You know, not a lot of things are consistent. Usually things change a lot, but the sun is one of those consistent patterns that you can build off of. And one thing you can do with that is a passive solar home is what they call it. So to kind of reduce your energy inputs or energy consumption, you can design your house so that, or it doesn't even have to be a house, it could be a shed that you don't want to heat, but you would like to be warm, or like a chicken coop or anything really, some kind of shelter. So basically, as it's shown here, the summer sun is high in the sky. You design your overhangs. It's not that hard, it's just a like an angle, basically. That's always the same. So as the summer sun's high, these overhangs are long enough that it blocks the sun from coming into your window. And then as it's getting colder in the season, the sun's going down to the winter solstice, and then now that sun is shining directly through your windows. It's kind of doing that here. Earlier this morning, probably that building is blocking it, but you can see the sun shining through those windows. So when that sun shines through those windows, you basically have a solar mass, or a thermal mass, excuse me. So just like basically a concrete floor or stone, or you have it shine on a big fireplace like this. And then that heat will collect and just keep absorbing and then release throughout the night. You also have I have friends who have like a house, and their whole floor is concrete, and they have the radiant heat with like tubes in the floor to heat the floor. You can have a system like that as well to help keep moving that energy around as it's collected. And you don't actually, like a floor like that is, you only have to keep the thermostat at like 65 because it's on your feet, it keeps you nice and warm. It's not forced air So then, kind of moving into soil development, growing good, healthy food with kind of lowest energy inputs. So basically all the properties around here, it's a pretty flat area, but there's always some kind of a slope. So after it rains, all that water, if it rains a lot, that water that is running down will not get absorbed and kind of just go to the lowest point. So we dig what is called a swale. So normally this would be, this is extreme for this area, but just a normal slope. So you come in, you dig out a little trench, almost like a little ditch, drop that soil, that same topsoil, and then you plant your tree on top of that. And then it's all level on contour, so it doesn't flow anywhere, it kind of just pools and then sits and slowly soaks in. So that's basically gonna have, build a water plume, I'll say, underneath that lower part. So over time, that'll keep holding moisture and moisture, so you don't need to water your fruit trees. It's a lot healthier system. Yeah. So that can actually build, as shown here, over time it'll actually build natural water springs that will come out of the ground afterwards. Yeah, so I kind of explained, it's just something we've been doing in practice. So this is kind of like the topical view of a piece of property. It's actually our property, and you get it from just Putnam County's website. You can go in there and click contours. They have contour maps of the land. So this is the highest point, 740 feet above sea level, and then you can see this is 739, 38, 37, 36. It's flowing towards this kind of this ditch. I don't think it's natural. But what I wanted to do is basically design this property so that it would collect this swale. So what we did, we actually put in our own swale, and it kind of follows this contour here, collecting all of this water as it flows away. So here's just some kind of so this is our process. So I built a simple A-frame level, put a level on top of it. You basically set it at a starting point. If you're going uphill, the little bubble and the level will go one way. If you're going downhill, it'll go the other way. So you just try to find that level spot. First I cleared off some of the clover there. Then I went through and found that contour, which, ironically, it was a pretty simple tool that ended up following this contour line pretty well. I was actually surprised at that. Swale, so this is me trying to dig it all up. So I took those stakes, just basically came in, took dirt, and then dropped it back here. So you can kind of see the rough outline of the swale starting to be built. And here's almost the final product before planting clover and stuff, just to keep it nice and healthy soil. Here we planted our first few fruit trees. There's a lot more there now, more on the way, I think coming Monday. So, yeah, you can kind of see the outline now. There. And this was late last year, probably in November, when we actually got rain in our lives. We had just over an inch of rain, and you can see how this swale is, everywhere else in the green areas is, it's probably still moist, but the swale is a really good image around the bend there. It's holding probably a couple inches of water. So the idea is that you just put it in there, or the water flows in there, and it kind of just slowly absorbs into that soil. this is kind of the image of the swale as of the other week. So there's all these fences are basically either a fruit tree or a nitrogen fixing locust tree. They're all kind of small for now, but as you can see, here's that slope again, kind of coming in there. And it's something you can use as like an access as well when it's dry. But you'll see a lot of weeds kind of growing in there too, but that's, to me, that's the natural germination condition of the soil after you disturb it like that. You know, dug it out, tilled it up, and did all that. So that's to me the earth saying, okay, all these weeds, we call them weeds, but they're like pioneering plants that first sprout up to protect Mother Nature's earth. She doesn't like to be naked. So that's basically telling me the kind of soil condition after I disturbed it. So hopefully over time we can improve that with having a more polyculture environment. Yeah, so then just kind of a little design exercise to kind of wrap that all up, you know, very high level permaculture introduction. So you kind of base it off the zones. So first we ended up, this was a long time ago, when we put a septic system in over here. It's kind of guided by regulations. Then we put in trees along here as a block for wind. So kind of the prevailing wind comes in from the west, southwest. That's all something you can just look up on the internet. So trying to get those started to grow. Pine trees, yeah, so block all winter as well. So now I just put in that swale, as you can see, with a food forest. And then something kind of like, you know, we're looking forward, but you know, maybe you could put a house here and a driveway, and then maybe like a greenhouse next to it on the south side. So the sun's always in the south for us in this zone. So you could possibly use that as a passive solar house with a greenhouse, you know, the sun coming in. And then your vegetable garden, possibly on the north side. And then you could put a pond in here as well with rainwater collection, an elevated tank in a garage or something that could, you know, overflow into your greenhouse, could overflow into the pond, which could overflow into kind of this, I didn't dig it, but there's just like a gully next to the road, which was kind of incorporated into that swale. So this long water system could then fill the swale up as well as the contour of the land. And then another thing is with that sun angle low and high, you can play with those angles and have the sun reflect off of that pond and kind of double dip off of that sunlight. You know, it's coming in from the top and then reflecting off the pond and into those same windows. You could have like a chicken coop where the water comes in, and then that natural manure fertilizer would then kind of wash into this swale as well, kind of giving you a natural fertilizer. And then basically your zones would be, zone 1 is something you're in, you know, hourly, all day. So, your house. And then zone 1 would be your kind of greenhouse, your driveway, something. Zone 2, you kind of go out. More time that would be, you know, backyard, kind of garden area. You know, maybe have some animals. Zone 3 would kind of be an orchard that you go in maybe daily, a couple times a week. And then zone 4 would be somewhere you never really go, and then zone 5 is something you don't really consider other than fire protection or something like that. Yeah, so that's just pretty much it. We don't really live on that plot of land at the moment, but I live in town, so it's kind of something permaculture can do is help you. It's scalable. You don't have to have those huge zones of, you know, go forward and all that. We just live in town, have a small garden, and something you can apply where, you know, you're doing a ton of polyculture. There's the three sisters, where you grow corn, squash, and beans all together, and they all kind of help each other build that soil for healthy food without, you know, spraying or other kind of inputs or fertilizer. The natural nitrogen fixing effect from the beans will help with that. Yeah. And then lastly, there's just some resources that I use if you'd like to learn more about it. Permaculture Design Manual is like a huge thick book by Bill Molson. He's one of the founders. PDF drive is actually great for anything. There's a ton of free books. I think I downloaded like 20 permaculture books that I'll probably never read. But there's, at any topic you want to look up a book to read, that is a place to find free books. Jeff Lawton, if you ever hear of him, he studied under Bill Molson. I took there's a course online for permaculture. That's the one I took. There's tons of information. And permaculture is not necessarily for, like I said, like gardening or homesteading stuff. There's all kinds of stuff like how to hold your money, like in valuable ways that, you know, kind of align with those principles in ethics. Your permaculture apprentice, he has a lot of databases of, he has all the plants listed in a table, their pros, cons, what they would be wanted to plant with or not with. Putnam County GIS, as I mentioned, has a great map that we have. And then other audiobooks. What I started with was What Your Food Ate. That kind of talks about your soil and how to make healthy food. It's a lot of science and like studies, but it's good information. Kind of get boring at times. But then the One Straw Revolution is like more of a spiritual book by Masanobu Fukuoka, and he kind of talks about growing food naturally in the most healthy way. I think that's it. So that's my little spiel.
Any questions?
Yeah.
I just clearly gave zero thought to our property setup when we built our house.
Yeah, I'm a nerd, so I'm kind of, you know,
Well,
I'm playing it all
I
out.
want to make the house look best.
Well, I think we all do that, and that's fine. But it's just like later, like we're doing now in town. Well, what have we been doing to our soil that it's not been good, right? Like we kill every dandelion. Well, as some of us know, mostly probably thanks to Taylor, but dandelions, you know, have so many good properties. You can literally use the whole thing and they fight cancer. Like, so what can we do that enhances our properties that is more in keeping with nature? And honestly, ourselves, right? Like we are nature. Like God made us perfect. So how do we keep that going and make it more fruitful?
Are you guys going to build a solar home like that? I one time spent like an entire month.
Yeah, we're gonna
I,
start a
like,
fund.
I went
Go
crazy. Oh, I thought it was so
Ideally,
exciting.
yes,
That's
but
so cool.
That's
it
my,
is.
yeah, something we
Yeah.
were discussing, but I'm pretty original and something like that.
Yeah. It's gonna be tricky because
Yeah.
it's like aesthetics, but also functional. And coming from a design background, it's like, okay, well, I get it. You want a pile of bricks in the middle of our house, but, so we'll figure it out. But it'll take some time. So we are sort of researching like what is sustainable in building, right? Like that to me is very interesting to look into. It's something I was never really taught in school. I mean, they talk about green materials and all these companies, like, yeah, they're certified and carbon credits and all these things, but it's not, it's kind of a cover of, like,
It's like a micro
kind of a
view
scam.
when you should be for macro level, looking
Yeah.
at like the big system of
Yep.
everything together.
well, it's still made of polyester.
Yes.
So, but you're saying it's recycled, so it's
Yes.
just kind of like
Right.
those sort of things, like how do we do that? But, yeah, it's been cool to learn about. Kids, we make them go plant things and they love it, right? What? You love it, right? I'm listening as usual. But anyways, if nobody else has questions, I do a few housekeeping notes. Our next meeting is November 8th, so that's our potluck. If you can bring something that aligns with the Weston A. Price view, that is always fun. Last year we had a really good spread of yummy foods. And if you don't have the book, you can look online or just make something good to eat. Then our Azure pickup's been going well, and I think the next, oh shoot, I did write it down. Adrian, of course, right now. I believe might be the end of the month, the next deadline. And we have our drawing. Wanna go get the thing? Did everybody put their name in? At Ottawa Brewing Company. So if you guys, I know some parents and things were interested. Hang on, yeah. If you know of anybody that wants to sign up, we have a few more spots left. So it's at Ottawa Brewing on October 22nd from 6 to 8. So let us know if, I know a lot of you already do it, but just in case. And anything else, Anita? Can you think of anything?
Nope, sounds good.
If anybody has ideas, we're probably gonna start developing the list for next year, for speakers and things. So if anybody has something they wanna hear about or talk about themselves, feel free to do that. All right, you wanna go ahead and pick one? Read it.
Yes, anniversary.